Central to Danny Boyle's spectacular opening ceremony of the 2012 London Olympics was a moving celebration of the National Health Service. But what Danny Boyle did not know, what hardly anyone outside Westminster knew, was that by the time the London Olympics opened, the 1948 Act of Parliament that had established the NHS, the National Health Service Act, had been quietly replaced 4 months earlier by a new act, the Health and Social Care Act. Momentously, this new act removed the statutory responsibility for the health of citizens from the Secretary of State for Health. That historic statutory duty had been central to the conception, founding and functioning of the NHS. At a stroke, the ability of Parliament to hold the government accountable for the health of the nation was swept away. Alison Pollock, Professor of Public Health at Newcastle University, said at a recent Rebuild Britain seminar.
The Act which completely removed the duty on the Secretary of State to secure and provide key health services throughout England. So this was a devastating blow. David Owen called it the Abdication Act, Abdication Bill, as it was going through Parliament. And of course that duty had been eroded, but it was a really a fundamental blow because it meant a real loss of parliamentary oversight and also local accountability as well.
So we say there are 2 simple steps to lay the foundations for rebuilding our NHS. Step 1. Any protection and renewal of the NHS has to be based on a restoration of the statutory duty of the Secretary of State for Health to secure healthcare for all through the democratic direction of Parliament.
Legislation is urgently needed, and it's urgently needed to reinstate the duty on the Secretary of State for Health to secure key health services throughout England. That duty was put in place in 1948. That duty was then delegated through area health bodies. Those health bodies have gone completely, and the Secretary of State is now hands-off, and NHS England has extraordinary power and autonomy. And the more that will leak out to shareholders and equity investors, it will just be wasted.
Campaigning solely for more funding for the NHS is insufficient. Without democratic control over the direction of NHS funding, and with more and more private company providers in place jostling to receive these funds, money sourced from taxes will always be insufficient and not wholly spent with public benefit as its foremost priority. Here is Alison Pollock again.
It's very convenient for us all to focus on the funding, and the argument that's being made is it hasn't kept pace with demographic change, but also a hugely expanding population over the last 30 years. Now, be that as it may, it still remains relatively high as a proportion of GDP, around 7 or 8%.
The government tells us that it doesn't matter who delivers healthcare, provided that it's free at the point of access. But it does matter, for apart from the exorbitant fees that private companies charge for their services, it is morally repugnant that profits should be made out of people's ill health, actually resulting in increased burdens on the public purse and on public services, as Alison Pollock highlights.
And actually the question that should be asked is, where is the money going, and is it actually being well spent, and is it going to the services that we need? And I think this is a really important issue because we know for some of the key elective surgery, hips and knees and cataracts, which are the big elective surgical operations and procedures, almost half and over half of these are now being done in the private sector but funded by the NHS. And of course they're being done in the private sector, which is taking the money and charging huge amounts. But what's beginning to happen is that not only is the private sector substituting for NHS, and the NHS is shrinking as a result, but the staff are also migrating over to the private sector to work there,
So what is step 2 to save the NHS from a drift towards a US-style healthcare system? The public good, public health, and the most cost-effective use of public NHS funding will only be achieved if we end the use of NHS premises by private healthcare companies. Step 2. End the use of NHS premises by private healthcare companies. Alison Pollock has a cautionary tale of this insidious development.
My colleague was in Moorfields Hospital, Eye Hospital, in the A&E yesterday, and he said he was struck as he was waiting in the long queue to be seen that Moorfields Eye Hospital was advertising all these procedures and conditions in its private hospital wing, which are not available in the NHS, and this was being done in the NHS emergency department. And of course Moorfields can do it because it's a foundation trust, and foundation trusts are intent upon generating income, and most of the big ones, especially in London, have got very flourishing private patient wings, private hospitals, and an increasing proportion of income coming in through private patients. Of course, the more private patients you take into your hospital, the less capacity there is to provide care for NHS patients.
So what of the 2 steps to rebuild the NHS? Are they realistic? Are they achievable? Well, yes, not least because these 2 key reforms are absolutely cost-free. They simply represent a political decision, a political redirection, a commitment to restoring the basic founding principles of the NHS and the concept of genuinely free healthcare for all. Provided by the public purse, controlled by the elected Secretary of State for Health, and accountable to Parliament and its public accounts oversight.
But at the end of the day, this is a political question. It's a political issue. We know from every country in the world, there's no country that has delivered universal health care through the private sector, and America is the greatest exemplar, where medical debt is a huge issue and the corporations don't care. So there's going to be a huge cost to the public if we don't reinstate the duty, and if we don't stop privatisation, and if we don't stop foundation trusts from contracting out and treating private patients. That is the cost to the public, and that's to go back to a properly planned system of healthcare and for areas which are locally accountable to people, and where people can now identify with our local hospitals, our community services, our mental health services.
So, in a return to the spirit of 2012 Olympic celebration, Rebuild Britain will take up the NHS torch and will plan to approach all candidates at the forthcoming general election to support 2 simple, cost-free policies. 1. Restoring the duty of the Secretary of State for Health to secure healthcare for all. And 2. End the use of NHS premises by private healthcare companies. If you wish to bring these issues to the attention of the public and to ask candidates to support them, click on the link shown on the screen or scan the QR code to register your willingness to help. And come the general election, we will send you a model letter that you can send out. Any time you can give could be crucial and invaluable in stopping the NHS from going down the road towards a US-style healthcare system. Be part of this campaign. Act now to restore the NHS to the control of the people who pay for it.